Hello again and welcome to my YouTube channel, and I'm talking about mental illness and suicide in Native American and Alaskan Native children and teenagers. I'll also briefly touch on the ratio of mental illness and suicide amongst kids from other indigenous populations around the world. So my name is Tracey Maxfield. I'm a nurse, author, peer specialist, stop bullying, and mental health advocate and educator. And November is actually National Native American Heritage Month, and so I thought it relevant that we actually look at mental illness and suicide in Native kids. Now, I'm sure there's a lot of you just have a stereotypical image of why there is such an increase in mental illness and suicide amongst Native American, Alaskan Native youth. However, I think if you'd be patient and actually play this YouTube video through and then actually read the accompanying article, which is actually a lot more detailed, I think you'll understand a little bit more about why there is such an increase. So first of all, mental health is actually structured around social, physical, emotional, psychological, cultural, historical, and structural domains. Our mental health is based on the environment that is around us and how it influences us both negatively and positively. Now, the challenge when we're talking about indigenous populations is that these populations really have not dealt with a medical model and the psychiatry and the medicalization of mental illness and suicide. They have relied more on cultural and spiritual remedies per se and treatment options. And because of that, I think that's where things have kind of gone astray, and there's so much misconception and also misinformation out there. So first of all, let's kind of review Native American, Alaskan Natives within the United States. So approximately 1.2% of the US population will identify as either a Native American or a Alaskan Native. And interestingly, what research has shown us is that approximately 21% of this population had a mental illness in the past year. And that's actually quite high. The actual, the way they compare it is that it's about approximately 830,000 people. Now this includes adults, children, teenagers, enough to fill every major league baseball stadium on the East Coast twice. So just think about that, that's huge. There are 554 federally recognized tribes in the USA, and I emphasize federally recognized tribes, including 226 native villages in Alaska. And Cherokees actually comprise the largest number of people in a specific tribe. As we know, there are more, but it's Cherokees have the largest number. So suicide has always kind of been recognized as being highest amongst Native American, Alaskan Native adults, but surprisingly it is also more prevalent than any other racial and ethnic group in the United States. And among US adolescents ages 12 to 17, Native suicide is actually higher than all other ethnic racial groups in the USA. It is actually 2.5 times higher than the national average, and that is actually quite alarming. Interestingly, before colonization, there was no word for suicide or mental illness or depression or anxiety in the various tribal languages. In fact, depression was described as a ghost sickness or a heartbreak syndrome, and PTSD is what they would call a wounded spirit. So amongst US adolescents ages 12 to 17, Native youth have the highest prevalence of major depressive episodes. And what's important to note is that along with depression comes an increased likelihood of suicide ideation, suicide behaviors, and actually attempts to die by suicide. Now, we know from our previous blog posts and YouTube videos that traumatic stress or toxic stress and ACEs, adverse childhood events, all influence our development as children and teenagers, but also kind of determine the likelihood of us developing a mental illness or disorder, not only during our adolescence, but also as we progress into adulthood. Now add into that the effects of colonization. And this is not going to be a political video or blog post by any means, but I want you to understand that colonization, which happened globally, so think Canada, United States, New Zealand, Australia, for a few. What colonization did is that it broke apart families, and so there was the loss of the traditional family stability, and with that came the spiritual, the cultural, the ritualistic things that they used to do together as a family. Colonization actually segregated people, and it actually sent native, for example, native children and teenagers, but primarily native children, to residential boarding schools. So it already separated not only from their culture, from their community, but from their parents. And what that did was that it kind of lost an erosion of the traditional and cultural values, the language, and the rituals that they used to do. Once they were forced into these residential boarding schools, they then went to foster care, and there were also forced adoptions. And so we're expecting a native child to now say goodbye to parents and move them into a home, usually of Caucasian adults who were very strongly religious, and you're expecting the child to actually adapt to these routines and this new way of life, and yet we're not giving them the tools, and we're not guiding and supporting them to do so. In fact, in those days, the way to support them was extreme abuse and violence, which would be physical, verbal, goes without saying, psychological, but also sexual. Also, what happened was total social exclusion and marginalization, because basically with colonization they denied the existence of these particular populations of people, and kind of left them in their groups, their camps, their reservations, but kind of left them to their own devices per se, but tried to influence the goals and the politics and the economy of culturalization. But these groups actually lived in extreme poverty because they were having difficulty adapting. And can you just imagine going into town and just, the way people reacted? And this is still prevalent today in the United States, maybe not as much, but this is still prevalent globally. This social exclusion, this racism, this marginalization. So when you think about that, right, the loss of communities, the loss of parental role models, the loss of family, language, culture, traditions, and then the socioeconomic factors with unemployment and, with many homelessness and extreme poverty, this historic trauma has been passed on from generation to generation. And with this historic trauma, it has resulted in an increased risk of mental illness or disorders in children and teenagers, especially post-traumatic stress disease, anxiety, depression, huge rates of depression, and much higher rates of suicide. Along with that, because of this historical trauma and the inability of the elders and the parents, who are now adults and older adults, to actually understand and deal with the healing themselves, they turned a lot to alcoholism, very common, and also substance abuse and smoking. And so this was passed on to the children, who saw it as a normal part of family life, but also part of their cultural identity, because they didn't know any differently. Now, I think the challenge is that when we have adults that have gone through colonization and what it did to them, and they were separated from their families, and then they were forced into residential boarding schools, and then they tried to be assimilated into Caucasian society, for want of a better word, without anyone actually supporting or helping them, because there was still the hatred and the ignorance surrounding them. When they then come back to their tribe and assimilate themselves back into the community, their learned behavior is going to be passed on to their kids. And so they didn't know how to be a parent. They did not know how to support, how to be a role model. They came with what they were subjected to, and this historical trauma is then carried on generation to generation. And that is where it's the cycle that we kind of need to break. So I'll give you some facts before I then go into contributory factors and treatment plans. So we know that Native children are 70% more likely to be identified in school as students who have a behavioral or an emotional problem. These kids experience psychological stress and abuse 1.5 times greater than the general population. Post-traumatic stress disorder, it's more than twice the rate amongst the indigenous populations than the non-indigenous populations in the United States. In 2013, 38.7% of Native adolescents ages 12 to 17 had a lifetime prevalence of illicit drug use, plus had higher rates than normal of lifetime tobacco use, marijuana use, non-medicinal use of pain relievers, and non-medicinal use of prescription-type psychotherapeutics. In 2012, almost 69% of Native youth ages 15 to 24 who admitted to a substance abuse treatment facility reported alcohol as a substance of abuse, compared to 45% from non-Indigenous populations within the United States. Approximately 26% of an Indigenous population group live in poverty in the United States, and 61% of Native children and teenagers have experienced at least one significant and severe traumatic event. That does not even include historical trauma. So you can see, even before they begin, these kids are set up badly. So contributory factors to a child or teenager developing a mental illness if they are a Native American or an Alaskan Native. So it's the absence of family and cultural rituals. There's parental psychiatric problems. Think traumatic abuse, alcohol use and related violent abuse. So we think of crimes, physical, sexual, lack of role models, overuse of discipline, physical, sexual, verbal, because they don't know any differently. Poor social foundations. Parents are usually uninvolved, punitive, non-nurturing, and authoritarian. And so they feel there's no sense of identity in place in the world. Now, what we have found is that by treating the problem upstream before the catastrophe happens, so that is employing preventative measures and therapies, the child and teenager has a much better outcome. And what preventative therapies seek to do is to enhance and redevelop the bond with the child or teenager, with parents, with other family members, with with teachers and peers, thereby enhancing the quality of life, but also reintroducing them to their cultural values, their cultural language, their identity. And actually what they found is that if teenagers are allowed to embrace their culture and to sit with the elders and learn all the stories and actually start to learn the language of the tribe, they have a decreased likelihood of turning to alcohol, drugs, and crime. So that is significant. Now, there are many specialized programs that are now in place to help Native American and Alaskan Native children and teenagers. And there's also reservation-specific programs, but that's going to be just way too long to talk about. So the most specific generalized programs are SAMHSA, it's a mouthful, Substance Abuse and Mental Health Services. And what that does, it makes substance abuse and mental health resources and supports available to everyone within the tribe at a very early age. And so they're encouraged to talk about it and to seek help and to find out more. Then we have PATHs, that's Promote Alternative Thinking Strategies. So that's where it promotes the emotional and social competencies, and it helps reduce the aggression and acting out behaviors in children because they can talk about what's going on. They have an outlet to express their feelings. Another one is SFP, Strengthening Families Program, and that's where actually it's more the parents, it's parenting and family skills development strategies to reduce abuse of the child, and then also how to deal with problems behaviors in the child without neglecting, ignoring, or abusing them. And to be perfectly honest, everyone in the world could actually use this. And then there's the PRIDE program, PRIDE, which is Substance Abuse Educational and Intervention. Other programs include life skills training programs, and preparing for the drug-free years, where it actually teaches parents skills to increase their children's opportunities for family involvement, thereby decreasing the likelihood of turning to drugs. And then stress inoculation training 1, which teaches coping skills to manage stress and anxiety at an early age, and I think that's awesome. So we have these preventative treatments. Then for the children and teenagers, the actual treatment plan is more spiritually based. And I think this is where things may start going sideways because in North America, we're very much a medicalized medical model. Whereas Native American, Alaskan Native, and other indigenous populations embrace their culture. So we cannot ignore the importance of ceremonies and smudging and smoke the peace pipe, community support, and we look at the HTUG, HTUG, historical trauma and unresolved grief intervention. Very, very helpful for the children, but for the parents to work together with the children to understand what colonization did. Native values, cultural beliefs, elder involvement, paramount. Introduction of their native language. Cognitive behavioral therapy has been found to be very helpful. Spirituality goes without saying, and then native staff and peer support. You cannot go into a reservation or talk with the tribe member if you do not have some knowledge and understanding and experience and have walked the walk and talked the talk. We really can't have a mass influx of Caucasian or other racial groups, despite being extremely proficient and knowledgeable, going in and sitting down with these indigenous populations and expecting them to trust us that we know best, because we have not walked a mile in their shoes. Now, according to Leach, a very, very famous author who has explored the effects of colonization on indigenous populations, he says that the problem with all these indigenous populations is that the effects of colonization created this horrendous stress and anxiety, which is now accumulated over generation upon generation. And this occurs when an individual is trying to adjust to a new culture, a new way of life. The stress can manifest itself through the victim's feelings of marginalization, depression, anxiety, and identity confusion. So now I'm going to actually look at a few of the other indigenous groups, and hopefully you can see that everything is so closely connected. Indigenous Australians comprise the Aboriginals and the Torres Strait Islanders, and they comprise about 3% of Australia's total population. Now, what research has found is that mental health problems, especially depression, anxiety, are 2.7 times higher amongst the Aboriginal community in Australia versus the non-Aboriginal community. For example, 80% of suicides in youth ages 10 to 24 are actually Aboriginals. And in any given year, at least 95% of the Aboriginal community are affected by suicide. I think what's happened is that in the past couple of years, suicide has now become the new norm and has been identified as children and teenagers as the only way to deal with their feelings of hopelessness and helplessness and marginalization and social exclusion. And it is the right thing to do, and that's extremely sad and it's extremely scary. So amongst Aboriginal Australians, what is contributing again to this increase in mental illness and suicide is poverty, racism, deplorable living conditions, economic hardship, exposure to violence and abuse, and a lack of understanding of Western medicalization and the Western way of life, and vice versa. Western populations do not understand how to adopt a person-centered approach, a holistic approach, embracing the cultural and spiritual and indigenous values a particular population has. Now, what the general consensus is, much like the United States, this trauma has been passed to generation and arose because of colonization. And lots of it is due to suppressed rage and hostility towards what happened, and that Aboriginals were in Australia first, and then of course Caucasian man comes along, starts bringing in their world, but excluding the Aboriginals as to become part of it. They did not embrace them to begin a brave new world, and so this has led to a lot of resentment. In fact, research has found that prior to 1980, the word suicide was not even part of the Aboriginal dialect, and in fact to this day there is still no word that describes suicide. Professor Pat De Jong is a Bardic woman, and actually she's Australia's first Aboriginal psychologist, and she did a global study on Indigenous populations, and she said that suicide is not just an issue for the Australian Indigenous people, but those from Canada, United States, and New Zealand are involved as well. And the one thing they have in common is the story of colonization. So as I draw to an end, I'm going to very briefly just talk a little bit about New Zealand and Canada, and you can see how everything is so very closely linked. Now, the Indigenous populations in New Zealand comprise the Pacific peoples and the Maori. And sadly, in New Zealand, an amazing country, beautiful country, but it is in the midst of a tsunami of mental illness, addiction, and suicide. In fact, New Zealand has the highest rates of adolescent suicide globally, and has done now for 3 years. And the suicide rate in Maori youth is 40.7% per 100,000. The sad thing is, New Zealand has been without a suicide prevention plan since 2016. Other factors which are contributing to the increase in mental illness amongst children and teenagers and the subsequent addiction and then suicide includes the influence and effect of social media. That is a huge problem. Then we're looking at historical trauma, and what their families and parents are in teaching them and talking about, and bullying. An interesting point is that New Zealand has and I emphasize the worst bullying leading to death globally. And again, no bullying prevention programs in place in schools, in colleges. In fact, bullying is even a problem in the workplace. And as I said, I'm really confused as to why they are not implementing bullying prevention plans and suicide plans. What they are trying to do is educate the parents, especially the Maori and Pacific people, to try and reduce their child's time on social media. And why that may be part one, there's so much more that they have to do, as you can understand. And so I will conclude with Canada. So I'm now a Canadian. I've lived here for 34 years. Our Indigenous people comprise the Inuit, the First Nations, and the Métis, and they make up about 4.3% of the national population. Suicide in Inuit youth is 11 times higher than non-Indigenous youth, and the suicide rate for males 15 to 24 is 126 per 100,000 compared to 24 to 100,000 in non-Indigenous males, whilst in females the rate is 35 per 100,000 compared to 5 per 100,000 females from non-Indigenous populations. So again, you can see we have definite connections here, and again it goes back to colonization. And in fact, I think it was last year, our Prime Minister, Justin Trudeau, actually publicly apologized to the First Nations and the Indigenous populations for the residential boarding school system and what it actually did to families and to those schools, because they really severed the connection between children and parent, sent them off to residential boarding schools where they endured the most horrific abuse. Many of them died because of the abuse. Many of them then left the boarding school and lived on the streets, turned to alcohol and drug abuse, because they either had a pre-existing mental illness or disorder which was not identified and treated, or the drug and alcohol use then precipitated them into a mental illness or disorder. And so I know it's all too easy when you hear people talk about, but look what's going on amongst Indigenous populations, to disregard the significance and the concern. But I think what's important to understand is that Native American and Alaskan Native, and the same is true in Australia, Canada, and New Zealand, they don't live on the reservations anymore. Yes, some do, but lots of them actually live out in society, and they go to school and college and university, and they work, and so they are part of our society. They are part of the world, as they have a right to be. And we really have to really consider everything when we're trying to treat a child or teenager who has a mental illness / disorder or is suicidal. We do the same for African Americans, we do the same for Hispanics, Asian population. They all have cultures and traditions and ways of life which we must learn to integrate into a treatment plan. And we may look and say ceremonies and smudging things can't help, but yes, they can help, because we know that psychological and spiritual connection and that sense of connection with others and society helps develop their identity and their confidence, but also lets them know they're part of a greater whole. And so it's imperative, just as we're very cognizant of gender neutral and lesbian, bisexual, gay, transgender, we have to be cognizant of indigenous populations and how we can ensure their needs are met too, because the bottom line is no one is exempt and we're all in this together. And so I hope you found this helpful. I apologize, it is a much longer video and it's an even longer article, but there's so much that needs to be discussed for people to start understanding why we have come to this stage. Thank you.